They shot me.
There's a code blue, I just running to medical ICU.
Hi, guys. Are you okay for us to use this footage?
I've signed my 37th death certificate. This is our COVID section. Generally, this place is very busy, that it sometimes overflows.
When it started spiking, the whole hospital almost got taken over by COVID positive patients. Initially, it was just one ward that they allocated to patients under investigation. As we progressed, it became the whole ICU, then it became another ICU, then it became 2 wards, and 2 wards became 3 wards, and the patient profile that we saw was sicker and sicker, and they had to convert one of the wards into a high care unit. Just put it there.
So he's a 40-year-old male patient, 48.
48-year-old, yes.
Blood pressure of 150, 88, post-ictal phase, and then on oxygen, 96.
Yes, on treatment. Is it an epileptic?
According to the wife, they don't know if he's epileptic. AGT was 13.6.
13.6.
Yeah, 13.6.
Sure. The gentleman came in, he collapsed at work, had seizures en route to hospital. With the paramedics, it subsided, and by the time he got to us, he had a decreased level of consciousness and he wasn't looking too good.
2, 3.
Hello, sir. My name is Dr. Karshagen. Can you hear me?
He's had 2 episodes with us. And
So he was moving all limbs.
Yeah, he was moving.
we didn't have an IV up, dog. He just literally removed it.
Okay, no worries. It seems like he had a fit and not known with epilepsy or anything like that. We'll try and look for a cause, see what's going on, and then we'll take it from there.
Wait!
This is in case he has a seizure again, so that we can give him medication to stop it. At the moment, he can't protect his own airway. We're thinking that he might need an intubation at this point, because if he stays like this and he starts vomiting, everything goes into his lungs, so it becomes a bit of a complex situation now. Mr. Singh, can you hear me?
Hello?
Mr. Singh, can you hear me?
You are in hospital, no? You are at London. What's your name?
Code blue, medical ICU, bed number 7. Okay, I'm coming. Thank you. Naughty. Give Ativan 2 milligrams. Load him with 1.2. Just keep an eye on him. I'm running to medical ICU quick. So there's a code blue in medical ICU, which is just like a very urgent emergency, which we need to attend to. Okay. What's happening?
Oh, the heart rate is dropping again.
Is there still a pulse? Let's check the pulse. I'm gonna start slow. Just get the bed for us. Get the bed down for us. Yes. Doctor? Can you take over here? Come real quick.
1 M.
So you can give 1 amp of adrenaline. Oh, Dr. Kolla. Oh, it's Ulrich, though. How is it? Should we? Okay, no. Guys, we can stop it. It's good. We're not gonna proceed. Okay. Thank you. We're not gonna actively resusc. Let me just see what the adrenaline did. Look, at the moment the heart's beating again, but if she arrests again, we're not gonna actively resuscitate. Okay. I think you must call the family, maybe just to come and say goodbye while she's still like this. The treating physician, the intensivist, Dr. Kala, phoned. I quickly had a discussion with him. He says that he's spoken to the family. She's been very sick for a long time. There's not much else that we're going to do, so it doesn't help us pushing on for too much longer. It's difficult because you can't get too involved with every patient, because otherwise you'll never survive. But unfortunately, it's part of the job, yeah.
I see death every day, and even though you work in a trauma unit, it's not the same. You can expect death if a patient comes in with a traumatic incident, but with COVID-19, a patient can be doing well and then suddenly just pass away. One day I walked through our ICU and we basically declared 7 patients dead in a row. And I thought to myself, well, if COVID wasn't around, these people would have been with their families. Sorry, I'm just, yeah. So, yeah, sorry. It really upsets me. And is there any, are you vomiting? No. Diarrhea? Coughing?
No.
Just shortness of breath. Any fever? She does have a history of cancer, so she is at risk. So we're going to be doing a chest x-ray for her, blood test. Yeah. I think she would most likely be a candidate of admission. She's on chemo and radiation.
Under which doctor?
Dr. Ngidi.
It's not the flu. We've lost so many patients as well, young people that we thought were able to overcome this. It's been trying.
It's going to take out all that gunk from there and it's going to make you breathe better. Take a deep breath in and blow.
Most people think that we as physiotherapists just do massage therapy and help sportsmen, but right now our role is so crucial in the management of COVID patients.
Okay, cough it up, cough it up.
We are trained to do what is called respiratory retraining. So just by the simple task of breathing correctly, proning, which means lying on your tummy, we were able to help our patients wean off the ventilator and then wean off other oxygen therapies and eventually get them home.
Nice deep breathing for me. Good job, good job. Are you okay?
Yes. Yeah. The COVID scar, the doctors told me, Mr. Saluji, you got a second bite at the cherry. Make sure to your creator, you are lucky that you survived, because now I passed the peak.
When someone beats COVID, it makes the long nights, early mornings worth it, because someone gets to live.
Getting used to what we're dealing with in the pandemic brought quite a sobering thought to a lot of us in terms of when you had a patient in ICU that was now going to need intubation, because the literature and the research out there testifies to that very little of those patients return from there. We started realizing that, and I noticed that the nursing staff started realizing it as well. And I remember one time I was in ICU, one of the specialists asked me just to intubate this patient, and the nurse stopped me and she said, listen, let's just get this patient to talk to family. And it really struck me because this patient can hardly speak anymore and they're confused a little bit and they're short of breath, but still she just wanted him to speak to her family for one, maybe for one last time. And yeah, they really care for the patients.
You must know you got no family support here. You got no friends coming to see you. The only people that you look forward to was the nursing staff and your medical staff that comes to you. Those are the people that you look forward to. And they were beyond. A+. The one doctor, he should come to me. He should hold my hand. Every day, when he should come. Assalamu alaikum, Uncle Muhammad, how are you? And that's something I'll never forget, because we couldn't get family coming to us. We didn't have. And that I will never forget. And that's, until today, he messages me every day, every second that we chat.
A lot of the patients don't realize it, but in casualty, when we start seeing them, we actually follow their journey through the hospital. And you know, the nice thing is that some of these patients come back to casualty to thank us, and the feeling is just great. I have goosebumps just talking about it. She was in there while she was... Hi, Mrs. Manana. So are you feeling okay now?
I'm very okay.
We were going to admit you.
Okay, I prefer to go home because now I'm feeling better than before when I came
Are you
here.
sure?
I'm very sure.
Okay, so because we did want to admit you, I've spoken to your specialist and the physician. then we would be required to actually get you to sign this form. So initially when our patient came in, she was quite ill. She was in bed. She wasn't able to move. So we've given her some medication. I've taken bloods. I gave her some fluids just to help, but she now says she feels a lot better. So she wants to go home.
It's a miracle that I'm going home.
Whenever someone leaves this unit or someone leaves ICU, we are all so happy.
Can you turn on your side quick? Drive it op neer kant. Leg, is it painful? Can you move the leg? Nowhere else. You only got injured here. Nothing else.
Nothing else.
Hulle het jou nie geslaan ook nie. Het hulle jou net geskiet?
Hulle het my net geskiet en toe ry hulle.
Kon jy nog loop?
Ja.
Jy kon loop?
Ek kan nog in die kar geklim het. Hulle is van elders af.
Van elders af?
Ja.
We often see a lot of gunshots. Because he was here a year ago for the same leg.
He's a regular customer. He's been here with the same problem previously, so he is quite lucky. Die vorige keer wat jy geskiet was, wanneer was dit?
In November die 3de.
Was dit nou dieselfde mense of wat?
Medical, surgical, allergies?
Nothing.
It doesn't look too serious. He's been shot in the leg, in the right leg. It seemed like it missed the bone, and he's still got good pulses, so we're not too worried.
We used to see gunshots and we're pretty used to managing it.
The community is very exposed to violent crimes like that. We see it on a regular basis, gunshots, stabbings, anything like that. We'll talk to our trauma surgeon. We discuss all gunshots and things like with our trauma surgeon. He might want us to do a scan to make sure the arteries, so the vessels in the leg aren't damaged, but at the moment I highly doubt that it is the case, but we might be on the safe side and just make sure that there's nothing injured.
Quite lucky, but quite close to it.
It was very close to the crown jewels.
Car accidents, gunshots, stabbings. During the COVID period, while alcohol was banned, it wasn't so much. But as it started opening up, then it started getting more frequent.
We're going to insert a central line for him. That's something that they'll be able to use to take blood and also to give him any medication that he'll need whilst he's admitted. Our drips are not working that well and he needs fluids quite urgently, so that's why we're going to just do this central line for him.
Mr. Singh, I want you to look this side, right? Because the doctor is going to work that side, okay?
It goes into one of the big veins here in the neck or at the shoulder, and then it's going to sit just outside of the heart, at the entrance of the heart.
What's your wife's name?
Nafisa.
She knows you in hospital. But it's fine, don't worry, we'll phone now, okay? All right. Okay, don't move, right?
So I'm just gonna first
Slowly
inject
breathe in,
something just
okay?
for the pain, okay?
Sorry.
To try and take away a bit of the pain.
Sorry, my dear.
I think one of the big things that gives me confidence and that gives the people around you confidence and that makes them calm is if you know what you're doing and if you know what you're talking about. Might be a little bit painful, but don't
move, okay? Because then we'll have to do it again. Sorry, my dear.
Especially in doctors in stressful situations, they recommend is to practice mindfulness and you just try and get your mind in the moment, and then everything that you were taught, all your experience just takes over.
No, it's finished.
Almost the worst part
Nothing
is
else.
over, okay?
But the idea is now just not to move so we don't have to do it again, okay?
The nursing staff is absolutely everything. We've got absolutely brilliant nurses here. Just confirm that we are right.
Yeah.
We work together as a team so well. I think that's very, very important because a doctor can't just be on his own, just try and manage everything on his own. You need someone to double check him, to make sure what he's doing is right, to give him advice and vice versa.
Wait.
Relax it out.
Keep
We
your
just
hands
want to
down.
keep
Keep it
this here as clean as possible. Yes, so don't move now, okay?
Just don't move. We almost finished. 5 more minutes, okay? Then you'll be able to sit nicely. Yeah, right.
Almost done.
And your wife is here, okay? We're gonna call her to come see you once we're done. Finished.
We're
We're just
going to
putting a
set you up
plaster.
just now, okay? We're happy that he's improving. He's talking now. He's starting to be more responsive. He can remember his wife's name and telephone number, so we're very happy with that. It seems like he's moving in the right direction. We're giving him a bit of fluid now. We're going to confirm that this line is placed well. We'll do an X-ray now, and then we'll just wait for the blood results from Lancet's side.
The little boy's having fits. He's having techimal seizures, or like an absence seizure, where he almost stares off into middle distance. And it's been ongoing for the last 2 weeks, so he's being admitted. The sisters described it as he was twitching. I haven't witnessed it myself to actually accurately depict what's happening. So he's going to go to the ward. We're going to swab him as well as his mum. Clinically, he's otherwise awake and alert. Let's see, 300 milligrams BD. Is that on top of that loading with Newton then? There's definitely a buzz around children in the emergency department. It's because it's more emotionally loaded. It's because there are parents involved. So you're not only treating the patient, which is the child, but you're also treating their parent.
How's the pain? Can we give you something for pain?
Please.
When was his last visit?
November.
Was that for this gunshot? Yeah. He probably had ATT then, so...
On one side we got Eldorado Park, and the other side we got Soweto. Then the other side we've got Lenasia. So it's something that's, I think it's more common than car accidents.
It's like a gang fight. They shot on me last night also on my car, and this morning they got me standing by a place in Eldorado Park, and they shot me in my leg.
We have to report it to the polices. Depending on the area that it happened, will be the police station that will notify it. Whether the case is opened or not, we just report it.
Like a double picture. It's the central line, which I said it is. The tip is in one of the chambers of the heart. You can cause a bit of damage, obviously, with this procedure because you can puncture the lungs, you can puncture the mediastinum, you can cause quite a bit of damage.
So you kind of got to know what you're doing.
Yeah, preferably, yeah. After everything and a bit of resuscitation, we've been able to do a couple of investigations, and amongst others, he has had a brain scan. It looks like he's got a lesion in the brain, very small, but we're not exactly sure where it's coming from, and that's what was most likely causing the fits that he was having. Coincidentally, we've also done an X-ray for him, and it's also very suspicious looking for COVID bronchopneumonia. You can see that there's what they call ground glass opacities on the X-rays visible there, which is quite significant of someone with COVID-19 pneumonia. That I don't think is necessarily related to why he came in today, but just goes to show that everyone has COVID until proven otherwise, basically. Mentally, you have to now think, okay, is there something specific I need to do for this patient? Is there something I need to do to protect myself, to protect others? So mentally, it also adds an element to the already stressful environment.
I don't feel safe at all. I can't see my family, I can't see my friends.
It's probably inevitable for us to get a second surge of COVID-19. It's difficult to predict. We can't say when or where or even if, but my gut's probably telling me that there will be a surge again. Hopefully we get a vaccine soon so we can manage it that way rather.
Is the physician still available?
She is still coming to see you. Can I hand over to you? Mr. Singh, 50 years old. Diagnosed for now, it's new onset seizures. Yes.